This conference will now be recorded.
Hello, I am Ali. Today we will talk about the multidisciplinary team referral letter, which may come in the exam. Okay, so this is a task uh, for the multidisciplinary team letter, which may come as a teaching or may come as a structured discussion. So first we wanted to talk about the multidisciplinary team meeting, how it will be done, the multidisciplinary team, and who will be there in the multidisciplinary team, what is the importance of the multidisciplinary team, who is the lead and who is the referring clinician for the multidisciplinary team. Okay, then we will talk about the referral letter, the multidisciplinary team referral letter. So the multidisciplinary team, the oncology multidisciplinary team, it, it is a meeting which take place weekly or monthly between the healthcare professional to discuss the individual patient case. Every patient who is newly diagnosed with cancer is discussed at this meeting, and also their scans and biopsies are reviewed by the team. Using the combined experience of the team member and taking into account the specific needs of each patient, so the multidisciplinary team will recommend their treatment plan. This discussion will be documented and will be shared or discussed with the patient via the telephone or through an appointment. The multidisciplinary team meeting is responsible for deciding any further tests necessary to the patient, discussing the treatment option for the patient, making appropriate referral letter to the specialized service, ensure that the patient needs are considered. The multidisciplinary team has a lead, and this lead is appointed member, and his or her responsibility is to lead the meeting and discuss any issue which may affect the target date of the treatment. The referring clinician, which may be the registrar, the SCT3, the consultant, this referring clinician should send all the detail or all the referral detail to the coordinator, which may be the administrative assistants, no later than 3 days before the meeting. Why no longer than 3 days? And this to give time to facilitate prioritization of the presentation and ensure that there is a time for collecting the investigation and the result of the investigation to be prepared for the meeting. Also, this referring clinician should ensure that the radiology is made available for the meeting, including the ultrasound, the scan, the CT scan, the MRI, especially the private one. We should have a consent from the patient, either verbal consent or written consent, and the patient should know that her case will be discussed through the meeting. Who will be there in the meeting? The meeting include gynecologist, oncologist, general gynecologist, clinical oncologist, oncologist specialized nurse, plastic surgery if needed, radiologist, pathologist. Sometimes we may also involve another health professionals like the dietitian, the physiotherapist, the occupational therapist, radiographer, psychologist, and counselor. Okay, what is the items of the referral letter? What should be written there in the referral letter? The referral letter should include some patient demographic like the name, date of birth, address, hospital number, GB, and the address of the GB. Referral details, which include the referring clinician, referral type, preoperative or postoperative, the provisional diagnosis, and whether the patient is aware of the diagnosis or not. Clinical information, which include the symptoms of the patient, the sign of the patient, the result of the examinations, the body mass index, RMI, investigation performed to the patient, whether it is a routine investigation, radiology like ultrasound, CT, tumor marker, and what is the result. And we should also involve the report of the radiology. The treatment the patient had to the hospital up to date, and finally we write a summary and what will be expected from the team. At the end, there will be the details of the referring clinician, the name, signature, and contact number. So this may come as a teaching scenario. Okay, so simulated colleague task. So this is a simulated colleague task, assessing communication with colleague, patient safety, apply clinical knowledge. So three domains are tested in this task. Your consultant is unhappy about the oncology multidisciplinary team referral letter made by your ST3 colleague, as he didn't use the perform of the unit. The letter is for 62 years old lady who presented with abdominal pain. Ultrasound show a right ovarian mass, complex features, 10 by 10 centimeter, RMI is 300. He asked you to give a constructive feedback about this letter to improve the future referral. You have 10 minutes during which you are expected to do what? To explain the importance of the referral letter, review the letters and give a feedback, answer the concerns, and support the trainee in his ongoing education. Okay, so this is a letter written by your colleague. Okay, for example, this is letters which include some details about the patient, about the symptoms, about the scan, and the signature of your colleague. Okay, and the performer of the unit may be attached there, like this one. Okay, so let's go through the teaching scenario. As general, you introduce yourself. Hello, I'm Ali, the ST5, and you are, for example, he may say Mike. Hi, Mike. Nice to meet you. Mike, I understand that you are the one who wrote the multidisciplinary team letter referral. Am I right? He said, yes, doctor, or yes, Ali. Did I do anything wrong? No, Mike, at all. You did an amazing job by writing this letter, but I want to show you a better way of writing it. Is it okay? Yes. So, Mike, did you write any referral letter before? Did you read any article about ovarian cyst or cancer? This is to check background and expectation from the meeting today. So put an agenda. Mike, we are going to talk today about the importance of the multidisciplinary team letter, when we should write the multidisciplinary team letter referral, and who will be there in the multidisciplinary team, and we'll apply that for our letter today. Mike, please don't hesitate to stop me and ask me at any time. Okay, you have to encourage him to ask a question and stop you if any queries. Okay, then go quickly through this point, and then after that apply this teaching for the letter written by your colleague. So Mike, let's go through our letter today. I can see that you wrote the patient name and date of birth. It will be mentioned here. Yeah, name and date of birth. Yep. So I can see that you wrote the patient name, date of birth. Amazing job, Mike. What do you think if you write the name of the GP and his or her address? It will be more informative to the team in case we need more information about the patient, or write back to update the GB about the patient. Am I clear? Yes, Ali. Okay. So, Mike, I can see that you wrote the name of the referring consultant, but it will be more informative if you wrote the referral type. It is pre-operative, post-operative, the reason for the referral, what is the professional diagnosis or the diagnosis, and whether the patient aware of this diagnosis or no. Am I clear? Yes, Ali. Okay, Mike. Mike, I can see also that you wrote this patient was admitted on the 8th of April 2018. Here it mentioned in the notes on the letter of your colleague. Are you agree with me, Mike? It will be more informative if you write the date seen by the clinician, brief summary of the presenting symptoms, important examination and finding, the body mass index and RMI, which is 300. Yes, Ali. Okay, so coming to the investigation, I can see that you wrote the ultrasound scan show large ovarian cyst and the routine investigation were normal. Do you think, Mike, it will be more informative if you wrote which routine investigation were done to the patient and more detail about the ultrasound scan? And we can attach also the report of the scan, Mike, as well. Am I clear? Yes. Also, Mike, if we mention the result of the tumor marker, if we did a tumor marker for the patient like CA125, it will be more informative. Am I clear? Yes, Ali. Mike, this patient, don't forget, we need to do for her CT referral before CT before the referral, and this to give more details about the cyst. Is it clear? Yes. Mike, don't you think it will be more informative if we write, if we mention what is the treatment received to the treatment received by the patient in the hospital up to date? Yes, Ali. Okay, so finally, Mike, we have to write some summaries. Okay, and what expected from the meeting, like the management plan. At the end, Mike, we should write here the name, your name, and your signature and the contact number. How does it sound with you, Mike? How improve teaching for other? Check for the feedback. Okay, Mike, I will give you some multidisciplinary team letter referral, and I will arrange another appointment to go through this again. Okay, thank you. Okay, and this is how you can do the multidisciplinary team letter referral teaching in the exam. Thank you.